It is my dream to have specialist head and neck cancer nurses. Our speakers this morning, and I think Ben said, it's so visible. If somebody's had a laryngectomy and they're breathing through a hole in their neck, you can't hide that. If somebody's had a big graft over their face, you can't hide that. A lot of other cancer sites, you can hide it. And you can walk down the street and nobody knows. Our head and neck cancer population, particularly during their treatment and just after, it's so obvious. Eating and drinking is so social. Come to my place and the first thing I say is, what do you want to drink? Some of these people can't eat and drink, so they're relying on a peg tube.
Just explain a peg tube, because it hasn't been mentioned, yeah.
A tube which goes into your belly to help you feed. Because of your reactions or your treatment, or your surgery, you can't swallow food at the moment. Mostly it will improve. Sometimes people have feeding tubes for the rest of their life. But eating and drinking and talking, it is such a social thing. And for a head and neck cancer patient, that is so impacted. I used to say you can pick a head and neck cancer patient a mile off because they'll always have a bottle of water if their saliva is an issue. So to have head and neck cancer nurses that are trained in that can not walk with the patient, that I don't mean that to be contrite, but to educate and support and tips and tricks and understand that I believe personally that the head and neck population, they're extremely complex, lots of issues.